Hi, welcome. My name is Dani Ibarra, and this is Tom, and welcome back to part 2 of our 3-part series called Sciatica Relief. In our first part, we focused a lot of the massage and the yoga on the gluteus maximus and the piriformis muscle. In this video, we're going to focus on those muscles as well as the gluteus medius, which is more on the side of the pelvis, and then this little muscle on the front called the TFL, which connects down all the way into the IT band, which goes to the outside of the knee. We're going to be using some products today to help increase circulation and blood flow. The mini roller along with the PUREWAVE massager. So just like part 1, we're going to take the mini roller over the gluteus maximus and we're going to roll out, getting into the piriformis muscle, but then we're going to take it more to the side of your hip. So these muscles, gluteus maximus and piriformis, were the muscles that turn your hip out, turn your leg out, and now the side muscles, the gluteus medius and the TFL, are the internal hip rotators. They turn your leg inward. So now we're going to get all the gluteal muscles, external, internal hip rotators, along with this IT band that runs down into the outer knee, which is very, very tight and not a lot of blood flow. Okay, Tom, so go ahead and make your way onto your back. You can have a blanket underneath your head, especially if your upper back and neck are tight. You want the chin to be level with the chest. Okay, so elevate your pelvis. And you're going to slip the balls or the mini roller underneath your right hip. Okay? And you want them up and down as you're rolling. So you're going to start to sway the pelvis side to side, and the balls are going to roll. Again, you want the massager to be on muscle and not bone. And you want the massage to feel hurt so good. If it doesn't hurt good and it hurts bad, I want you to either take some weight off of the balls, or you can sit up and roll them yourself. Okay. So connecting to your breath as you're swaying back and forth. And the further now you sway your pelvis over towards the left side of the mat, the more the balls are going to roll into the outer hip muscles. So now we're getting gluteus medius and TFL. They're probably quite tender, so if it doesn't hurt, you're not in the right position. Again, it should hurt so good. How you doing, Tom? Okay?
Good.
Good. And connecting to your breath the whole time. So we're not only increasing circulation and creating more mobility and flexibility in our muscle groups, this is also very down regulating for our nervous system, right? So you might find that you're more relaxed after massaging and doing this practice. Okay, so now Tom, come on up to a seated position. It's hard to roll the TFL lying down, which is why I want to show you how to roll it in a seated position. So he's going to roll the outer thigh into the knee. It gets more tender down closer towards the knee. So that TFL that you were just rolling is a smaller muscle. If you look over here on the skeleton, it's a smaller muscle located towards the front of your hip. Well, it attaches to the IT band. The IT band is white on the skeleton to show you that there's not a lot of blood flow to that area. When this IT band is tight, you feel the pull in your knee, you feel pain in your hip. So again, everything in the body is connected. So as he was rolling that TFL, it was actually sending blood flow and circulation down into that tight IT band. A couple more rolls. Good. And then release. And now Tom's going to show us on the other side how to use the PUREWAVE massager. So you can lean on your side, that's probably easiest. Use a pillow for your head if your neck starts to feel tight. Prop yourself up, yeah. So you can massage all the same muscles. So starting with the gluteus maximus, you're looking to get those areas that feel tender. The higher you turn up the intensity, the more even the massage. If you were to turn this down, the massage changes and it gets to more of a pouncing sensation. Both feel good. It's really up to you what type of massage you're in the mood for. You can put whatever you like, Tom.
Thank you.
You're welcome. So he's getting the front of the hip, that TFL. He's getting the gluteus medius muscle. And he's getting all the way down into the IT band, just increasing, rushing more blood to this area. You'll find that massaging before stretching, it just makes your stretches feel more open, especially if your body's tight. A couple more moments here, Tom. How's that feel? Good?
That's good.
Feels great. I'm jealous. And of course, if you're doing this at home, you can do everything that we're doing a little bit longer. And I'm going to have you come off now. Make your way onto your back, Tom. The massager over there. There you go. And then legs bent or straight, whatever feels most comfortable in your body. I recommend keeping your knees bent, feet on the floor if you have back issues, because this position may not always feel good for your lower back. So we'll take a moment to just settle in and feel. Notice what's going on in your lower body. Notice if your pelvis feels more relaxed. Your body feels like it's become more grounded, more steady. Take a long, deep breath in, filling up. Open the mouth, exhale, relax the shoulders, any tension through the jaw. Again, inhale. Exhale, breathe it out. One more centering breath in and out. And just setting the intention before we begin for healing, for relaxation. And a reminder that you don't need a lot of time for self-care. Just a few minutes of using these products, a few minutes of doing the right stretches will make your day, you'll just go through your day easier. Make your body feel better. Okay, Tom, hug your knees in towards your chest. And try not to interlace the fingers, just like Tom's doing, hand on top of each knee. So we're gonna take this into some dynamic, which means moving options. So you're gonna take the knees away from your body until your elbows straighten. The hands will stay holding onto the knees. And as you exhale, the elbows will bend, the thighs will come close to your chest. This is a really simple movement. Continue on your own. A really simple movement that not only helps to target the gluteal muscles, but also the lower back muscles. So a lot of these stretches that we're doing, even though we're targeting sciatica, we're also helping your lower back feel better as well. Good. Do one more. Notice how that when you bring your knees away, your low back lifts. And when you bring your knees in, the lower back softens. Just do actually one more so we can feel the lift of the lumbar spine, this curve. And then the flattening of that curve. And then rock your legs, Tom, side to side, just massaging out the sacrum. Staying connected to your breath the whole time, maybe even keeping your eyes closed and just listening to my voice. Allowing your attention to notice what's going on the inside. Good. Find center. Separate your knees apart. Give the knees a little tug up towards the shoulders. So again, just creating more width and space. Everything we're doing here is to create freedom in the body. If something does not feel good in your body, I'm going to ask that you make the movements a little bit smaller. Nothing should hurt you. Take in one more breath. Bring the knees together and lower the feet down to the floor. Okay. Bring the right knee in towards your chest. Turn your thigh bone out and place the foot on top of your left knee. Okay. So we did a variation of this in our part 1 series. Same work with the foot. You want the foot to be flexed. We are opening the hips. So when the hips are tight, what's at risk is the knee. So keeping the foot flexed is actually protecting the 4 ligaments around the knee so you don't injure your knee while opening your hips. As we move through this little sequence of postures, I want you to really listen to your body. Again, if you feel pain in the knee, make the movements smaller or skip anything that causes discomfort. Okay, so from here, Tom, you're not going to hold on to the leg, but we're going to bring the legs in. It's going to be dynamic. So the legs will come in towards the chest and then set the foot down. I want you to use your core and not your lower back. So draw the belly down, inhale, the legs come in, exhale, you lower the foot. Good. And again, as you're moving the legs in, this right thigh is pressing away from your body. And then exhale it down. One more time. And then release it down. Good, pause here. The foot's going to stay on the knee. Drive down through this left foot and do a small lift of your pelvis. So it's a little scooping of the tailbone. It's not a very high bridge. And you'll feel both front of your thighs get some length and openness. And then as you exhale, lower down slow. Drive into the left foot, inhale, rise up, scooping the tailbone under, creating length to the lumbar spine. Exhale, lower down. 2 more times on your own. Very good. Last one, inhale. And then exhale. And take a moment here and pause and just feel. Okay, so we have one more part to this side. I'd like for you to lift your pelvis up and shift the hips to the right, just a small amount. The legs will come in towards your chest, and then you'll slowly drop the legs to the left side of your mat. We're trying to get the foot to come flat to the floor so that the knee goes up. Now, if your foot does not reach the floor, I do not want you to strain. Just grab a blanket or you can place a pillow underneath this foot so that the foot has something to press into. So the inner right thigh is going to lengthen towards the inner knee, opening up these internal hip rotators. How you feel? Yeah? The outer right hip, it doesn't really move, but the intention is to release and drop it down. It will change the way the pose feels. And then take your right arm, Tom, and stretch it up over your head. And he's just gonna open up this whole right side of the body. You should feel a lot of sensation in this outer hip area. We're targeting piriformis, gluteus medius, gluteus maximus. We're getting into the lower back muscles. Take in one more cycle of breath, finding something new on the exhalation. Good job. Lower the right arm down. Hook your thumb right into the front of your hip crease. Okay, so you're going to depress the hip with that hand. This left hand is going to come up on top of your knee. Now pull the knee down any amount. It's going to be different for all of us because we all have different tightness in our hip and different openness. So as he pulls his knee gently down, it's really the outer thigh that he's pulling. He's going to push the opposite thumb into the hip. So we're trying to move the thigh bone in two opposite directions, again, targeting deeper into those gluteal and hip muscles. And then inhale, let the knee come up just a little bit. And then again, exhale, pull down. Good, release up. Now engage your lower belly a lot. Pull the belly down and then release, coming back through center. Very good. Place the foot to the floor. Take a moment, pause here, and breathe. And we'll come on to the second side. Bring your left knee in. Place the foot on top of the right knee. Okay. Send the thighs away from your body and flexing through this front heel. Draw the belly down so your navel pulls to the spine and you bring the legs in towards your chest. Exhale, lower the foot to the floor. Repeating that 3 more times on your own pace, your own breath. One more. Good, pausing. Now driving down through this front foot, elevating your pelvis up off the floor, giving a little scoop. It's a posterior tilt to your pelvis. Exhale, lower down. And again, inhale, lift up. Well, you may notice with this particular one is one side of the buttock wants to lift up higher than the other. Work to lift both sides evenly. Do that 2 more times. Opening the front of your thighs. So what you're doing now is you're getting some length to your psoas muscles as well as opening your gluteal and hip muscles. Very good. Rest, breathe. Shift your pelvis over to the left side of the mat just a little bit. Bring the legs in. And then as you exhale, you're going to drop the knees over to the right side. Again, adding a blanket or a pillow under that foot if it doesn't reach. Now some of you might be able to hold on to the ankle. You can. If you can't reach, it's not a big deal. You're working to depress or release this outer left hip down. It's really subtle. And then bring your left arm up over your head. Good. And now just continue to focus on the breath, creating length, breathing into all those sensations. This is actually a really big stretch for your hip. Good. A couple more. On your next exhalation, release the left arm down, slip your thumb into the hip crease, and then hold on to your top knee. Gently draw that thigh down any amount as you depress, you push the hip away. Try arching your back just a little bit. I find that I get deeper into those muscles with a little arch. But let the knee come up slightly. And just once more, exhale, bring it down, holding here. Very good, release, engage the belly, and release back to center. Good. Pause here and just breathe. All right, Tom, shift your pelvis over to the right side just a little bit. Okay, knees will come back in towards the chest. Moving into a gentle twist. Both knees will drop to the left side of your mat. Okay, take a moment to settle in here. Bringing some rotation to the spine. Widening across your heart center. We're just going to add a little extra to this twist. Take your left hand and place it on top of the outside thigh, top of thigh. So elevate, lift your top hip up just a couple of inches. And I want you to resist your hand into outer thigh into hand. And as you're resisting, stretch your right buttock down towards the bottom edge of the mat. Good. Keep resisting for one more cycle of breath. And then relaxing. Engage the core. So you always want to engage the core when you come out of a twist, so you're not using the wrong muscles, which are your back muscles. Set the feet down. Good. Shift the pelvis a little bit to your left. Bring the knees back in. Inhale. Always twisting on exhale. Drop your knees to the side. So see if you can let the legs relax. I should have said this on the first side, but if it's hard for you to get your bottom thigh down, you can always slip a blanket or a pillow underneath your bottom leg so you have that grounding support. Letting the spine soften, widen across your collarbones. And then placing your right hand to the outside of your left thigh, lifting the top thigh just a couple of inches. Resist now. So you're pushing down as you're lifting the whole inner thigh up. Stretch your left buttock down towards the bottom edge of your mat. And this is specifically targeting sciatica pain. Give yourself one more breath here. Relax, engage your core first, and then roll back to center. Very good. Find center with your hips. All right, now cross your shin bones and let your knees open out to the side. Feet will be on the floor. So if this is a hard position on your hips, if your adductors, inner thighs are really tight, feel free to place a blanket or a pillow underneath each outer thigh. We're gonna just take a few moments here just to settle in. This is a nice external pose. We did some neutral stuff and this feels really good just to counter the work that we've done so far. So feel the belly rise and fall as you breathe in and out. Let go of any gripping or tension through your inner thighs and outer hips. And then go ahead and switch the cross of your legs. So we open up the other hip. Let your body settle once again. Slowing down the breath, flow. Sliding your legs out onto the floor, coming into Shavasana for just a brief moment. You can always stay longer. Shavasana is a way to end the practice and allow everything to reintegrate back to center. So allow the body to surrender with each exhalation, letting go. And wiggling your fingers and toes, start to deepen out the breath. Stretch your arms up over your head, taking in a full body stretch. And hugging your knees towards your chest. Rolling to your right side and pausing on your side for a moment, allowing your heart to rest and your blood pressure to regulate. And as you're ready, come on up. We'll close the practice together. Crossing the shins, bringing your hands together in front of your heart, lifting the spine. As you move through your day, move through with greater awareness to how you're holding your body, greater awareness to your breath. Honoring yourself for taking this self-care time for you today to help you feel better. Bowing your chin down towards your heart. Honoring the light within. Namaste.
Namaste.
Thank you so much, everybody, for joining us.